He served as the director of the White House Office of National Drug Control Policy since February and was acting director for about a year before that. U.S. drug czar Michael Botticelli and 5th District Congressman Hal Rogers are our guests tonight on Issues and Answers, the Mountain Edition.
Issues and Answers, the Mountain Edition, is sponsored by the City of Hazard. Come home to the mountains.
Congressman Hal Rogers, U.S. drug czar Michael Botticelli, thank you very much for being with us today.
Thank you.
Congressman,
Thank
good to see you again. Both of you just attended a great Operation Unite roundtable discussion in Manchester that I attended. And first, Mr. Botticelli, I want to ask you your first impressions of Eastern Kentucky and what you heard today during that discussion.
I think I heard today a tremendous amount of energy and enthusiasm and the community coming together and all sectors of the community coming together. So law enforcement, prevention, treatment, people in recovery, community-based organizations, faith communities, coming together to really identify what's been working as we really struggle to deal with the prescription drug and opioid issue here in Kentucky and in the country. So I was filled with a lot of optimism as I heard what's been working and some of the reductions in overdose death that we've seen in many of the counties here in Eastern Kentucky. So I think it provided me a great opportunity to listen and learn about what's been effective, what additional federal resources we need and federal attention that we need to continue to make progress on this issue.
Congressman Rogers, what did you think of what you heard earlier today?
Well, it was a wonderful group. I guess, 20 people from all corners of Eastern Kentucky, from all occupations dealing with drug abuse. A great discussion, and they wanted to be able to share that with the director, the drug czar, and we wanted to impress him with what we were doing, and I think it worked.
One interesting stat that I heard came out of Clay County, where overdose deaths have been dropping in the past several years.
In fact, Clay County had 23 overdose deaths in 2011.
Yeah.
Last year, 2014, just 2.
Right.
Floyd County went from 38 to 17 in a 2-year period, and Knox County went from 19 down to 7. I don't have the numbers for 2014, but we are seeing dramatic decreases in overdose deaths, and that's the ultimate scorecard that we're trying to impact. For the first time in a long time now, at the end of 2014, the national tally keepers said Kentucky was finally absent from a list of the top 10 worst performing states on drug abuse. And in some of the classes, we were dropped out of the top 30. So we are making progress. Something's working, and I've got to believe Unite's having a big impact on it.
Mr. Botticelli, you were confirmed by the Senate as the nation's drug czar just a few months ago. What's going to be your main goals going forward in your new position?
Dealing with the prescription drug and opioid problem is perhaps my highest priority in terms of the work that we have. This isn't a problem just in Kentucky, it's a problem around the country. And in 2013, we had 120 people dying every day of a drug-related overdose. And so it really compels me to do work and do better, make sure that we're having all of our time and attention focused on this incredibly incredible issue. Some of the solutions that we heard today are things that we can replicate nationally. So a good prescription drug monitoring program that we heard in some of the success, making sure that law enforcement is working in partnership with public health are things that we heard today that we want to continue to promote nationally. One of our top priorities is making sure that people have good access to treatment, and I think that we have seen here and around the country the role that timely access to substance use treatment plays in terms of preventing overdoses, preventing crime. That's one of our top priorities as we go forward.
Now, your predecessor also came to Eastern Kentucky, Gil Kurlikowski, and Congressman, there were actually results that came out of that visit.
There was, and it was of great help to us. He spent several days here, as is Botticelli's doing, learning what we need. And he was very helpful in supplying some additional help to us that's been very, very effective. You know, to demonstrate the devastation that this problem is causing in people's personal lives, one dramatic story, it keeps popping in my head. I went to the Harlan Boys and Girls Club a couple of years ago, and wonderful place, beautiful kids, beautiful sight. But they told me they had to add an additional thing to their menu there, grief counseling in a Boys and Girls Club. What a sad commentary. But then they are getting a handle on it. There were 13 kids there who had lost a parent in the last 6 weeks to overdose death.
That's sobering statistic.
And of those 13, 11 of those kids was present when their parent died.
Yeah.
And so they've had to add grief counseling to what they offer at the Boys and Girls Clubs in Harlan. But that's not unusual for all the other counties.
And Director, you've been affected by alcohol abuse firsthand. Kind of tell me about your battle with addiction years ago.
So I always say, Steve, that my story is not unique. I'm one of 23 million Americans who struggle with addiction. Just about every family I've ever talked to has someone who's been touched by this, and I'm not alone. And my story and my struggle with addiction, but probably more importantly, my 26 years in recovery kind of show me that recovery is possible, and that's also what we want to demonstrate while we're here. And we've heard some remarkable stories for people who've been able to get help and get treatment. And my story is not unique. I'm one of millions of people in recovery. So we want to make sure that we're promoting kind of that hope, letting people know that there is not shame and stigma associated with having addiction, even though we know that there is. But we know that can prevent people from seeking care. And I've heard countless stories with parents whose kids are affected, or people who've been personally affected, who are afraid to seek care because they feel so ashamed and they feel stupid. And we know that addiction is a disease, and we know that we can't arrest and incarcerate our way out of addiction. We've tried that at great taxpayer expense. And so I hope to use my own story as an opportunity to really diminish the shame and the stigma, but also to show that there's hope, that we do have good, effective treatments, that recovery is possible. So, I always say that, I'm really not unique in my recovery, but really want to use my office as an opportunity to promote it, to talk openly and honestly about it. And I think that we owe that to the families, not only in Kentucky, but nationally, to really shed a light on this really most dramatic issue.
You both recently attended the National Prescription Drug Abuse Summit in Atlanta. I hear it was the biggest one yet. Tell me what came out of that this year.
We had 1,400 people from every state in the union, plus more. People from law enforcement, from the courts, from treatment, medicine, and so on. Every discipline was there. Sort of a magnification of Unite here at home. In fact, that's what it is. And we spent 3.5 days. This is the 4th annual summit that Unite has put together for the nation, and this one was in Atlanta. We heard from the head of the Center for Disease Control, who says prescription drug abuse is an epidemic. We had the head of the NIH, National Institutes of Health, and the drug abuse specialist there. We had the governor of Oklahoma, and we had 6 congressmen and Senator Manchin from West Virginia. Great meetings, and of course the director was there as well, above and beyond everybody else. But it was a great, great meeting, and there's an excitement and there's an energy. It's electric that we see in those summits down there in Atlanta that spreads back to their home states. And I think that's one of the main reasons why we're seeing overdose deaths begin to creep down nationally.
What were your thoughts, Director? Was that your first summit?
This is actually my second summit.
Okay.
So, but but I agree. I think it gives, this epidemic has continued to change. So I think it gives the federal government as well as state and local folks the opportunity to get together to really examine what's happening in different parts of the country, but to also share, I think, success stories that we've seen pockets like Operation Unite, which I think is a great example, but we've seen pockets around the country where we're seeing success, and we can use the National Prescription Drug Summit as an opportunity to really look at and highlight those models of successful programs for replication across the country. One of the things that I love about doing this work is about the passion and commitment that people bring, and I think the chairman's absolutely right that these are all people from all over the country, from all sectors of society, who are really committed to making a difference here and feel moved by it, feel compelled by it. So this is probably the only forum that we have on a national level that bring everybody together to really examine the issue and to really come up with good solutions to the problem.
We've heard a lot recently about the rise of heroin addiction. It's probably a bigger problem in other parts of the state than here in eastern Kentucky. Prescription drug abuse is still a huge problem here. Nationally, what do you see as the biggest issue right now? Is it heroin? Is it prescription drug abuse, or something else?
So prescription drugs still remain one of our top priorities. So as we look at the data in terms of misuse data and overdose data, mortality and morbidity associated with prescription drugs still eclipses heroin. And as the chairman talked about, we've made some progress. We've been able to reduce prescription drug misuse among youth, among adults. We've seen a leveling off of prescription drug-related overdoses. But what's been particularly disturbing is the increase in heroin use and heroin overdose deaths, not to the magnitude of prescription drugs. But nationally, over the past 30 years, we've seen a 172% increase in heroin-associated overdose deaths. That's largely been attributed to the influx of very pure, very cheap heroin in parts of the country. We see a small percentage of people who are progressing from prescription drug misuse to heroin use for economic reasons, sometimes just because addiction is progressive and people move from one substance to another. So we know that we need to continue our focus on prescription drug use issues, but also focus some additional attention on the growing heroin problem. Along with the heroin problem, we've seen a dramatic increase in viral hepatitis. We've seen a huge outbreak of HIV in a rural county in Indiana of late, largely linked to the injection of prescription medication. So we know we still have work to do as it relates to this issue.
Well, let's talk about another hot topic, and that's legalizing marijuana. What are your thoughts on specifically medical marijuana, legalizing marijuana as a whole, and do you believe alcohol is more dangerous than marijuana?
So I think we have to separate out medical marijuana from legalization efforts. And for medical marijuana, I think we really have to rely on science and research to show the way, like we do with any medications. Many medical associations have determined that we really need to have good scientific research, and that smoking any medicine is probably not a good delivery device for a medication. So the U.S. government continues to invest in good scientific research as it relates to the potential therapeutic value of the components of marijuana. Legalization, I think, is for personal use, I think, is a different matter, and the government remains opposed to legalization efforts. We have abundant scientific research to show the health harms associated with marijuana. We heard today at the roundtable really compelling stories about how particularly early marijuana use can set a chain of can set in a chain of events to really lead to more subsequent and serious addiction. So we know alcohol, tobacco, and marijuana use from a very young age can really chart someone's course to more significant addiction, including prescription drugs and heroin. I think the other issue that really alarms me is the development and commercialization of marijuana. I have been doing public health work a long time and have seen our work on tobacco, and particularly working with industry to diminish the advertising that's geared toward youth. And I see the same thing happening with big marijuana, that they're coming up with brightly colored advertisements and candy-infused marijuana that particularly target youth and some of the most vulnerable people that we have. So while we support good scientific research for medical marijuana, the government does not support legalization of marijuana.
So do you believe alcohol is more dangerous than marijuana?
I don't think it's helpful to compare one drug against another, because I worry. So do we say, well, cocaine might not be as harmful as heroin, so let's legalize cocaine instead? I think what you have to do is look at each drug in and of itself and look at the health harms that are associated with each of those. We might have more negative consequence as it relates to alcohol, because it's a legal substance. And I'm not saying we go back to prohibition, but part of the reasons that we see the magnitude of issues that we do around alcohol is that it is legal, and we know that many youth use alcohol in pretty harmful ways. So I don't think it's really helpful to compare one drug against another, or one substance against another. I think you really have to look at what does the evidence say around the harms for an individual substance.
Well, going back to tobacco, Kentucky has tried and failed multiple times to pass a statewide smoking ban. Is there research nationally to support areas with smoking bans are healthier?
I'm not as familiar, just because tobacco is not I'm not familiar with the latest research as it relates to smoking bans. What I will say, and we see the same issue on the drug side, that usually availability and perception has a great deal, it sends a message particularly to youth. And so again, part of our success with tobacco has been to diminish the availability, to diminish the social acceptability. We want to do the same thing with drugs that we have done with tobacco, and making sure that our kids know that there's risk associated with these, and they're not getting messages to support that drug use is healthful.
I'll ask both of you this. Are we winning the war on drugs?
I think we're winning battles. The war is still on. We've got a long ways to go yet. But we've had some recent encouraging reports from East Kentucky on prescription drug abuse. It's still a big problem, but we're seeing some encouraging things.
I see the same thing.
I would agree with the chairman. A good friend and colleague, Dr. Nora Volkow, who's the director of the National Institute on Drug Abuse, often talks about the fact that we know what works here. So it's not as if we don't know what's effective in terms of our prevention and treatment. Our goal, and with tremendous leadership and support of people like Chairman Rogers, that we're beginning to really fully implement what we know to be effective. I think the other piece too is we understand that criminal justice reform also has to be part of the work that we do. That arresting and incarcerating people with substance use disorders is really ineffective. So I'm tremendously optimistic that with a tremendous amount of federal leadership, congressional support, with communities coming together, that we can make a difference in what we're doing, and that we can win against this issue.
And two, the battle, I think, is shifting from the streets to the classrooms, to the schools. We've jailed over 4,000 pushers, and they're still out there, some of them. But I think the education part of Unite, trying to keep our kids from listening to somebody who offers them a joint or whatever, to armor themselves against the inevitable temptation they will face. I think the battle is in schools, to keep our kids away from people who are bad people.
This is an issue you might not totally agree on, Obamacare, the Affordable Care Act. Director, how do you believe it's affecting folks getting treatment for substance abuse?
So one of the things that we know, Steve, is only about 18% of people who have a substance use disorder get care and treatment. You compare that to diabetes, which has about the same prevalence, and about 75% of people with diabetes get care. One of the main obstacles, we talked about the obstacles that stigma play, but one of the main obstacles that prevent people from getting care is insurance coverage. That while we have federal resources to support people who don't have insurance, we know insurance plays a large role in people's ability to access care. The Affordable Care Act, I think, does two remarkable things as it relates to accessing care and treatment. One, it says that substance use disorder treatment must be one of the 10 essential benefits that insurance companies and Medicaid expansion has to provide. And the second is that we know many insurance companies, particularly private insurance companies, have long used discriminatory practices to keep people from getting care. And through the congressional passage of the Mental Health Addiction Equity Act, that insurance companies now have to provide those benefits just like they do any other health benefits. So it's really, I think, remarkable in terms of the Affordable Care Act's ability to make sure that people get access to good care, and that insurance companies are meeting their obligation in providing that care just like they do any other health benefits.
A hot topic today at the roundtable, pharmaceutical companies are continuing to manufacture stronger formulations of pain medication. The question is that really necessary? I know you feel strongly about that, Congressman.
Well, I've been fighting with them now for 10, 12 years, FDA, who had been letting on the market things like OxyContin with very little warning to doctors and the public about the addiction power of OxyContin and the difficulty in kicking it. So over the years, we've been fighting the FDA to come up with rules and regulations when they legalize a drug for the market, that if it's an opioid, that it have some abuse deterrent characteristics. Like OxyContin, they changed the makeup. It's no longer a pill, it's a gel. You can't crush it and shoot it up, you can't smoke it, you can't burn it, you can't swallow it or whatever. And that's what we're driving at. Now, they've now adopted a rule we've been pushing in Unite for these years to require any opioid coming on the market have an abuse deterrent characteristic, whether it be gel or maybe it's something else. So we've had some success finally in getting FDA to understand the epidemic that we're in with prescription pill abuse. And they're coming around slowly but surely.
Do you both generally agree that treatment is a better option for drug users than locking them up?
Mm-hmm. I would agree. I think that we have seen, we know that about 70 to 80% of people who are in our correctional facilities are there because of usually their own substance use disorder. These are not the people that Chairman Rogers is talking about that we should incarcerate, the dealers and the peddlers. We know that those folks should be in correctional facilities. But we need to have a better response to people with substance use disorders. It's ineffective to just lock people up, but it's also very expensive, and I think we've seen that we can't continue to build prisons. So we heard today from judges who are implemented drug courts in just about every county in Kentucky, which has really been, I think, a stellar model in terms of how we move people away from incarceration. They're tremendously effective in getting people to achieve long-term recovery. So we know that we need to continue to focus on implementing programs like drug courts and other diversion programs to keep people out of our correctional facilities. That, again, I think is an area that has tremendous bipartisan support across the country, and I think we're going to have more significant opportunities really over the next few years to think of more wide-scale criminal justice reform. Let's keep our jails and prisons for those people who really need to be in them, and making sure that we're getting good care for those people who can be served in the treatment system.
I think the drug courts are one of the best things we have. When we started Unite, we had one county with a drug court. Now we got every county with a drug court. And those drug courts are where you take people who are charged with some nonviolent crime, and the judge says, okay, I'm going to put you on probation. You got to come in every other day or whatever to do a drug test. You got to have a job. You got to support your kids and so forth. And so long as you do these things, we won't send you to the pen. But if you violate that, we'll put you away. That has had a great effect. It's tough love with a lot of these people, and it works. I'll be going to a graduation service tomorrow at one of our drug courts. You ought to go. It's worth seeing.
A couple more big issues I want to make sure we talk about. One is drug testing. How do you feel about that? and maybe expanding it. There's been talk of making a drug test required for those on food stamps, for example. What do you think about that?
I think we have to be very careful, quite honestly, in terms of how we use drug testing in our systems. We had the opportunity to talk to a longtime principal today about drug testing, and I think, even he had kind of mixed feelings about using drug testing. I think it's fine when we're looking at like people in drug courts and making sure they're being compliant with treatment, but we shouldn't be using just drug testing as our only prevention vehicle. I think that we know that we have good prevention programs out there and we need to use them. I think when they're part of a comprehensive look at this issue, I think it's important. Certainly parents, I think, see them sometimes as opportunities to make sure that kids are telling them the truth around what they're using, but I think we have to be kind of very careful and wise about how we use drug testing. We can't use drug testing to really supplant kind of good conversation between parents and kids, between evidence-based prevention programs, and that's what we really want to foster. So I think that, we have to make sure that we're relying on the evidence to make sure that we're implementing kind of these kinds of strategies in good ways.
Neonatal abstinence syndrome, another huge issue. What's being done to curb that problem?
It's one of the issues that we talked about today, and how I think the federal government needs to respond in a more dramatic way. We heard some compelling evidence today around not only just providing, so we've seen a dramatic increase in the number of newborns that have been born to moms who suffer from an opioid use disorder, and not only the care that they need for hospitalization, but also lifelong care, I think was something that we heard today. So we really need to make sure that we are doing a better job at identifying women of childbearing age and pregnant moms who might be using, making sure they're getting good access to care and treatment, and that we're providing good neonatal care for infants who have this. But it's been a big issue. And we've seen a dramatic increase in the number of babies that have been born to moms who have an opioid use issue.
I got one question from a viewer who used to be in law enforcement, and this didn't come up today, but synthetic drugs and synthetic drugs being sold on the internet. Is that a problem you're seeing more of, and what's being done to curb that?
Synthetics are a growing issue here, and we were talking about the drug testing issue before. And synthetic drugs are often used by kids and other people as a way to get around drug testing, because usually those drug tests are not testing for those synthetics. It's really a challenge for us on the federal level and even on the state level to stay ahead of the synthetics issue. So as the federal government and the states have rescheduled these substances, chemists will often tweak just a molecule of these to get them out of control of federal and state authorities. They are often really misrepresented in terms of their marketing. They are talked about as not intended for human consumption, even though they are, and often sold on the internet as a marketing device to do this. So again, I think while we've had some success both federally and at the local level around synthetics, it's one of the issues that remains a concern for us.
Only a few seconds left, so my last question will be, what do you think your biggest challenge will be in the next couple of years?
It's to diminish the mortality that's associated with the prescription drug and the heroin issue. It's the number one issue.
All right. Director Botticelli.
Thank you, Steve.
Congressman Rogers,
Thanks,
always a
Steve.
pleasure.
Thank you.
Thank you for joining us. We'll see you next time on Issues and Answers.